Hi, my name is Kalia McShann, and I want to welcome you guys back to my channel regarding my doctoral journey. I wanted to thank everybody that made a comment or a suggestion in regards to dissertation topics that I can research and that we can discuss together. And a special thanks to Nurse Yolanda. Okay, so I grew up on the south side of Chicago. I'm located in a marginalized community with several economic, social, and healthcare disparities. So when she brought up the disparities affecting communities, urban communities, as far as labor and delivery, being taken out of hospitals, or the lack of health care for pregnant moms and babies coming in, this was one that actually touched my heart, because I had experience with working in labor and delivery for about 4 years. And I want to say it was in Harvey, Illinois. If anybody knows about Harvey, you know that location and the patient population that that particular hospital serves. And the lack of care and resources that are given to hospitals in marginalized communities, the need to increase the awareness as well as increase providers to this particular area or demographic group is essential. Also, wanted to talk about another topic that someone brought up to me regarding urgent care centers and the wait time in emergency rooms. We know, well, some of you may not know, that hospitals and organizations have gone from like a fee-for-service back to like a value-based care system. And this is mainly because of I want to say, the Affordable Care Act that has given patients and families, individuals, access to health care. So with the increase of access to health care and a decrease in staffing shortages, people are using the emergency room for basic checkups, for basic blood pressure, diabetic medication, when they are having extreme long wait times to get in to actually see a primary care provider. So there are a few things, or a few areas that I would even like to throw out there and see what you guys think, as far as what can leaders do to help mitigate this issue. I believe several hospitals have gone into like streamlining their emergency rooms, where they will have fast track access when patients are coming in and their blood pressures is out the roof. They will send them to a nurse, and maybe a nurse practitioner will come in and actually treat them there, and maybe prescribe a 7 to 14 day supply and have them follow up with a primary care. But besides all of that, by the time, if you have a waiting room full of patients waiting to be seen, and you're going through hundreds of acute care issues, by the time you actually get to an emergent case, what are the outcomes with those patients? We're not able to provide timely, credible, quality care to these patients that actually need to be seen. So what can leaders do to create a process to help urgent care centers as well as emergency rooms navigate this crisis? I am looking forward to your comments. I have some resources and some strategies that I believe that can be very helpful. I will share them in another video. But again, Yolanda, thank you. Nurse Yolanda, thank you for bringing to our attention the disparities and for marginalized communities regarding labor and delivery. The other area that is under talked about is children. Children, their resources being taken away. So I want to propose a question, and I know this is kind of random, but I want to see what you guys think. if healthcare changes its whole algorithm of how they deliver care, what they used for compensation and reimbursements, and we know that Medicaid, Medicare may or may not be still in existence in a few years, what are we doing as a healthcare industry to make sure that patients are able to receive adequate health care? Um, Again, I have some suggestions and some research, and as well as some things that may not work. But have you guys been thinking about that? Like, if we had no uh, system of reimbursement, how do providers, or would they stay in healthcare, or would they continue to provide care? I'm curious. Let me know.